Please note that this session is being recorded today. My name is David Nelson, and I'm an associate professor in the Department of Family and Community Medicine and faculty with the Office of Community Engagement and member of a clinical and community team focused on the issue of lead poisoning in the city of Milwaukee. Today's webinar is co-hosted by the MCW Office of Community Engagement and the Advancing a Healthier Wisconsin funded project called Clinical and Community Solutions to Lead-Free Children. I'd like to begin with a statement from the Office of Community Engagement. We wish to acknowledge the Indigenous people who are past and present stewards of the land on which we pursue our just cause of a healthy community for everyone. Again, thank you for joining us today for session 1 of our 2-part webinar series. Today's session is focused on community responses and solutions to lead. Through presentations and a panel discussion, we will learn about issues of lead within the community from a parent, a pediatrician, and experts from a variety of sectors working to combat lead poisoning in our city. We hope that by the end of today's session, you will have some understanding of the history of lead in Milwaukee, current data, common sources of lead, the impact of COVID-19 on this issue, and strategies for improvement. A few things before we begin. To our attendees, please be sure that you are muted throughout the webinar. Please do use the chat feature to share comments and ask questions. We will be monitoring throughout, so please post your questions as they occur. We will have several points when we address comments and questions, and we'll do our best to get as many as possible. We are also committed to scholarship of community engagement. Thus, we want to be sure you are aware of our Institutional Review Board statement. Themes from discussions and surveys could be used in future publications. No identifiable information will be used in any publication. Your consent is implied by attending. If you have questions or concerns, please contact Sarah O'Connor at this time. At this time, I am very pleased to provide my introduction to my friend and colleague, Dr. Stacy Young. Dr. Young?
Great, thank you so much, Dr. Nelson. And again, welcome everyone. I'm pleased to set the stage today for what promises to be a very informative session. When our Office of Community Engagement at the Medical College of Wisconsin decided to partner with the Clinical and Community Solutions to Lead-Free Children project to present this webinar series, we did so because we believe in the power of convening community and academic representatives to learn about, discuss, and take action on complex issues. I'd like to take a moment to discuss community engagement. We use a definition that focuses on collaboration between academic institutions and larger communities in a context of partnership and reciprocity. Why is community engagement so important? Well, for several reasons. One, community engagement can eliminate health disparities and advance health equity. Community engagement recognizes that community knowledge is as valuable as academic knowledge. Community engagement takes into account the context of communities and the lives in which people live. And community engagement recognizes that without relevant community recommendations or research, there is no broader uptake of ideas. Community engagement is also critical as we seek to dismantle the root causes of health disparities in Milwaukee. In July of 2019, Milwaukee County declared racism as a public health crisis, recognizing the detrimental health outcomes facing people of color. Since then, over 170 jurisdictions across the United States followed suit. What does this mean for our important work? Well, it is imperative that we invest in health equity and bridge the gaps in healthcare access to ensure that everyone in our community has the opportunity to thrive. I'm excited that our discussions such as these today will be moving us forward. So with that, now I am pleased to introduce Dr. Heather Parady. Dr. Parady is a pediatrician and public health professional whose career has focused on care for vulnerable children and families. She currently serves as medical director for the City of Milwaukee Health Department and continues to see patients at Children's Midtown Clinic. Dr. Parady, I hand the mic over to you.
Thank you, Dr. Young. I'm glad to be here today to give an overview of the issue related to lead its ubiquity in our environment, and its health effects, particularly for children and vulnerable communities. Lead has the atomic number 82, as you can see pictured here, and the symbol Pb. It's a heavy metal that is known for its malleability, its durability, and low melting point. Next slide, please. As a result, lead was added to many products in our built environment, from gasoline for cars and other small engines, household paint, both interior and exterior, and pipes and plumbing used to carry drinking water. And unfortunately, we are still suffering the repercussions of these decisions generations later. Next slide, please. Lead does not occur naturally in the body, and there is no known safe level of lead. The Centers for Disease Control have been engaged in setting blood lead levels since 1971. Initially deemed an elevated level of 25 micrograms per deciliter in 1985, then proceeding to a lower level of concern of 10 in 1991, and now a reference level, reducing this level to 5 in 2012, and in the recent months to a level of 3.5 micrograms per deciliter, acknowledging the advancement of our science as well as the recognition that there is no safe level of lead. Next slide, please. Nationally, we have made great strides to reduce childhood lead poisoning through legislations here throughout the 1970s, 80s, and 90s. Legislation that removed lead from our gasoline, from paint, and from plumbing fixtures. Additional environmental regulations in the early 2000s set standards for lead hazards in the environment and continue to be updated as we make advancements in the science and laboratory techniques related to lead detection. Next slide. Similarly to the nation, Wisconsin's rates of lead poisoning have declined over the decades. With changes in reference levels come increasing numbers of children recommended for clinical and public health follow-up, as you can see depicted in this slide when the reference level changed from 10 to 5. Expansion of this graph to today would include the new recommendation of children, inclusive of the level of 3.5 and above. Next slide. Lead poisoning is a statewide issue with geographic areas of clustering, as you can see most noticeably in southeastern Wisconsin. Each red dot on this map represents an address associated with a lead poisoned child, having a blood lead level of 5 micrograms per deciliter or higher. Next slide. Paint, primarily peeling, chipping, paint, or dust around areas of friction in households, remains the primary source of lead poisoning for young children at the population level. Given the exploratory nature of young children, including crawling, hand-to-mouth behaviors, and outdoor play, children can easily ingest lead dust or paint in environments where it is present. Next slide. Plumbing and the water that it carries may contribute additional risk to individuals under certain conditions. Lead service lines are the main conduit of water into homes. Replacement is often costly, and the division of costs can be a political decision. Because as you see, the water main, which goes from below the street underneath the car in this picture, all the way to the house, is jointly divided between the municipality and the individual homeowner. I should also point out that lead can also exist in interior plumbing within homes, not just service lines made of lead. Next slide. Lead service lines do also exist throughout the state, carrying both municipal water supplies and those who rely on well water. Some additional sources for significant lead poisoning for certain individuals or groups at risk may include traditional medicines and herbs, imported foods and spices, and specific cosmetic items. Shown here, kohl, which is an eyeliner that is used in some cultures. However, it has also been found in lipsticks produced within the United States. Jewelries, particularly those that have charms that could be ingested or swallowed, painted or dyed toys, and glazed ceramics can leach lead that is ultimately ingested by a child. Next slide. We also see adult recreational and occupational exposures that can put both adults and the children who they live with at risk. Things such as battery smelting facilities, stained glass, shooting ranges and hunting shot that can contain lead, and small engine aircraft fuel. Shown here is a 2017 incident in Wisconsin at Fraser Shipyards in Superior, Wisconsin, where a $7.5 million settlement was reached when more than 60 workers were exposed to unsafe lead levels while working on a Great Lakes freighter. Ultimately, 171 workers out of 233 tested had detectable blood lead levels. Lead can affect multiple organ systems and can deposit into the soft tissue and bones for later resorption at certain points in life, making children and pregnant individuals most at risk for its toxic effects. Children are especially vulnerable to the harmful effects of lead because of their developmental and exploratory nature, again, their hand-to-mouth behaviors, the increased absorption of lead that children exhibit, and their developmental vulnerability during key developmental stages of life. Additional risk factors include age of the child. We see a peak incidence of lead poisoning around age 2. Oral behaviors, food insecurity, having low iron specifically, or being in an anemic state can enhance the absorption of lead when it is present or ingested. Household aging condition, including contaminated soil that may exist around houses. Having a birth outside of the US, in particular with specific cultural practices and imported use of imported goods, as shown previously, and having a family history of lead. Well, very high levels of lead in the body can result in encephalopathy or even death. Much, much more common is chronic low-level exposure over time, which has a much more insidious effect on children's growth, behavior, learning, and development. The poisoning of children has lifelong effects on not only their personal health and academic attainment, but ultimately on their societal productivity. Next slide. This map supplied by the Wisconsin Department of Health Services shows the percent of children with lead poisoning by local public health jurisdiction. The darker purple or red indicate the highest percentage of poisonings within those jurisdictions. And listed on the left are the top 10 local public health jurisdictions across the state that see children with lead poisoning. Note that the cities of Milwaukee and Racine are numbers 1 and 2 on this list. Looking more locally, the City of Milwaukee Health Department has produced a series of lead dashboards for our community, both overall as depicted here, as well as divided by aldermanic district. And these can be found at the website. They were just updated most recently in 2020. The heat map that you see on the left shows the areas of concentration of lead poisoning in our community, with the red and orange being the highest rates of lead poisoning. And you can see the clustering in our city, like many other issues across our city. The segregation that we see ties closely to the incidence of childhood lead poisoning. And you can see the clustering on the near north and south sides. We also have listings of, per aldermanic district, the number of properties in the district that were built before 1978, again, a risk factor for lead-based paint. The number of properties with lead service lines, the number of units that have actually been made or deemed lead safe through work of public health in the private sector, the number of water filters that have been distributed to households. We have statistics on the population of children in these districts, numbers and percent tested, and numbers and percent poisoned per district. You can see some of the variation that exists, that we have some districts with poisoning rates as low as 1.9% and others as high as nearly 16%. Next slide. So if you take a drive through some of the neighborhoods with the highest lead poisoning rates, those in the red and orange on that map, many of these images will probably look familiar. You can see peeling and chipping paint on porches, on windows, and on the eaves of buildings. This graph, again, from our partners at the Wisconsin Department of Health Services, shows the disparities that exist in lead poisoning by race and ethnicity. Disparities exist for all ethnic and racial minorities, but are the largest for Black children. Compared to white children, those who were tested for lead in 2019, Black children had 4 times greater odds of being lead poisoned compared to their white counterparts. Asian children and Hispanic children, approximately twice the odds compared to white counterparts. This shows our distribution of lead testing across our community. And the dotted line indicates the incidence of lead poisoning. So while you can see that testing is not equal across the lifespan, we do a very good job of testing many, many individuals when they are just beginning that crawling and at the highest point of their hand-to-mouth behaviors, around age 1 year old or 12 months. However, when you look at the dotted line, when the most lead poisoning is diagnosed, or the incidence of lead poisoning, you can see that we actually diagnose most cases of lead poisoning at age 2. Thus, opportunities for enhanced continued testing throughout the young lifespan. COVID has also had a dramatic effect on testing, since most at-risk kids, as I mentioned, are asymptomatic and routinely tested as part of well child care or attendance at WIC, the Women's, Infants, and Children's Program. When the Safer at Home orders were placed early on in the COVID pandemic in March of 2020, it had a dramatic effect and precipitous drop in lead testing, as you can see on the purple line, the line depicting our 2020 testing rates, whereas the line above shows the average lead testing over the course of a year from 2017 and 2019 averages. So although our lead testing has rebounded too throughout the course of 2020, it still remains at only about 2/3 of prior testing levels. As we move into the next portion of our series and start to discuss some of the medical, public health, and community aspects related to lead poisoning, it's important to refer to some key terms. There are 3 different levels of focus or intervention that we often discuss, in particular in the prevention or public health space. These are primary prevention, secondary, and tertiary prevention. Much of the existing work focuses on secondary and tertiary prevention, either those who are at risk or those who are already affected by an issue. Using policy, legislation, and resources, we ultimately want to drive towards primary prevention so that we can ensure that future children are never affected by lead poisoning in our communities. Next slide. Pediatric lead poisoning is a condition that is 100% preventable. And despite great advances in lowering the blood lead levels for the entire population of children, certain children remain at substantial risk for exposure to lead and disproportionately experience its negative health consequences. Ongoing lead exposure, particularly among minority communities in Milwaukee, is a reflection of persistent structural inequities. Thus, lead exposure can be considered both a result and a cause of health inequity and environmental injustice. Next slide. I've listed a few additional resources that are easy to find through Google searches, both national, state, and local resources that you may want to visit to get additional information and/or data related to pediatric lead poisoning. Next slide. And finally, for those who are interested to dig a bit further into some of our country's decision-making around lead and why it has been used where and what some of the implications and repercussions are today, I listed a few books that you might want to pick up and that many of us on the panel have collectively read. So I thank you for your time today and happy to hand it over to our next set of panelists.
Thank you, Dr. Parady. And I'm going to save some questions for afterwards, but we had a number in the chat, but we really thank you for your presentation today. Next up, we're going to hear the community perspective. Within community engagement, we want to call on people in medicine and research, but it's also important for us to enter into the discussion with people from the community. And today we are very pleased and pleased to present Ms. Shyquetta McElroy, a parent advocate with the Coalition on Lead Emergency. Ms. Shyquetta has supported parents like herself with children suffering from the effects of lead poisoning. Her goal is to educate and help as many parents as possible to get the lead out of their lives, homes, and children, and to continue to hold elected officials and government officials accountable. As Ms. McElroy continues to strive for better, she says she will always remember the stories of the people and how together we believe, yes, we can. Ms. McElroy, I turn it over to you to share your story. Thank you, Shy.
Hi, everyone. Thank you for having me. I am a mother of 4, and originally I started to gain knowledge or even heard the mention of lead poison when my oldest, that is now 15 years old, I know, wow, he was an infant. And we were going to WIC. He was getting his finger poked, and they were checking our iron and checking his lead levels. And that's when I found out that my son had elevated lead levels. So this was somewhere around between 2 to 5 micrograms per deciliter. And this was throughout that whole year of our visits. And so no one ever told me that I needed to see a doctor about it. I was just told that I needed to, feed him different nutritions to try to help his lead levels, but there was no intervention. And like Dr. Parady said, there is no safe lead level. And my son and myself, my family is living proof of that. So throughout that year, me being a young mom, I never realized, the effects that lead poison would have on my son until he entered into K5. When he entered into K5, he had an IEP done. And well, before he had the IEP done, he actually repeated K5 for the second time. And that's when he had an IEP done. And as we pulled his medical records and looked at some of the things that were causing these issues, everything centered back around lead poison that he experienced as an infant for an entire year, from an infant up until 1. So outside of that, that's when I started to educate myself with what is lead? How did this happen? What is going to be the effects of this? How does this look going forward? And again, I'm still a young mom, so I was only taking in the things that I was hearing, with the list of things that would be an issue. And I thought that was for right then. While my son was 5 years old, I thought it was something that would go away. You know, you get a fever, you take medication and you feel better. You know, you have any kind of, you know, regular illness and you take something and it goes away. So that's what I thought. But I was sadly mistaken. My son is 15 now. He's a freshman in high school. He goes to Riverside, and I'm a super, super proud Tiger mom. And I see now the effects that it has on my son. He has cognitive and educational delays. He has anxiety issues. He has ADHD, and that's just a short list of the things that my son suffers from. But the biggest part of it is that it's something that is never going away. This is something that my son will live with for the rest of his life. And I didn't know that. I wasn't prepared for that. And I said 3 years ago, when he was in the 7th grade, I said, you know what? He can't do this by himself. The doctors are only going to do what we ask. So me being a mom, a parent, and loving my children, it's my job to stand up and take the right initiative and take a stronger initiative. So I went back to school. I got educated on how to educate my son. I got educated about what lead is and what lead poison is and what it means to our children and to our household, how I can get lead out of my home, how I can check for lead, how I can keep lead for my toddlers, who I have twin girls now, how I can keep them from going through the same thing that my 15-year-old went through. So through doing that, that's what brought me to Coalition on Lead Emergency, because it was my chance to say, now I have this information. Now I'm making my life better. Now I'm helping my son, giving him the adequate education, the adequate help that he needs to live with this disorder now that he'll have for the rest of his life. I want to help others. I want to talk to other parents. I want to talk to other children. I want my son to be a part of that. And he has been this outstanding young man and a spokesperson of his own to talk to his peers and let them know, like, just because we had this happen to us, don't mean that it's the end of us. And that's the most important thing. So now, through the work that I do with Coalition on Lead Emergency, I talk to parents on a day-to-day basis. And a lot of these parents, I find, they're on the same path that I was going, with not knowing what they can do, not having the resources, not knowing that the resources are out there to help them prevent lead poison in their home. A lot of parents that I talk to don't even know about the paint in their home that's causing lead poison to their children. Don't even know about the water that they're drinking every day out of their faucet that's causing lead poison to their children. Don't know about dusting their homes that's causing the lead poison to their children. So I really take pride and take a stance on making that information possible to as many parents as I can talk to. And as long as it'll take, we equip these parents with water pitchers so they're not drinking the water. We have done work with the health department and SDC with getting people homes abated for lead. Some of our parents that we've talked to have actually completed the process. And I'm so proud that it's just one more family that's being protected from suffering like my son is going to suffer for the rest of his life. We make the best of it. I'm not saying that this makes him any weaker. I think it actually, despite how bad it is, it makes him stronger, because he knows that he has to work even harder than the next student or work even harder than the next person, and he doesn't mind. So did lead poison defeat my family? No. Do I wish it ever happened? No, I do. I wish it never happened to my family. I wouldn't wish it on anyone's family, because it's a silent, and I say this a lot, it's a silent disease, and it's a silent monster, is what I tell my younger children, because we don't realize how many places, how many surfaces that lead can be. And education is the first thing. We definitely need to educate the public, educate our children on how to stay away from the dangers of lead poison. So through the work that we've done with advocating for the ARPA funds to get funding to the health department to help get the lead levels down, advocating for the actual level down from 20 micrograms per deciliter to 10 micrograms per deciliter. Like, these are all victories that we need, and we need to keep pushing. We're gonna keep pushing, and we're gonna keep talking, and we're gonna keep telling our stories. I talk to parents on a day-to-day basis, and these parents, once they get educated, I see the fire light inside of them, like I did when I got educated and I knew what lead was and how it was affecting my family. That light fires up inside of them, and they want to do more. They want to see more done. They want to advocate more, and they want their story to be heard. So that's basically, in a nutshell, how I got involved with COLE and what I do with COLE. This is made possible by the parents. We have so many parents who've done interviews, who've went to joint finance meetings and advocated for other parents. And this is not just parents. We talk to grandmas, we talk to grandpas, we talk to uncles, aunties, sisters, brothers, because children are our future. And if we're wiping out our future with this deadly disease, then what does that say about us? So I take full responsibility and responsibility of all those around me. So I will educate, I will talk about lead. I talk about lead probably every single day. I know some people that I talk to are probably tired of me bringing up the subject, but I just want to make sure that no one has to go through what my son has to go through. Before he went to high school of his freshman year, my son actually sat in front of me when he graduated from middle school, and I was so proud of him. And he said, "Mom, I'm tired, I'm exhausted." So I said that to say, when Dr. Parady was listing off the different effects that lead poison has on our children, some of the effects that's not included in that is the mental effects, the mental effects, the self-esteem effects that it have on our children. You know, you take on a whole nother role with every day uplifting someone. And my son sat there and said, "Mom, I don't think that I want to go to high school. I'm exhausted. Learning is very exhausting. I feel like I barely made it." And I had to uplift my son and let him know that you're a hero. You're surviving. And just on that note alone, you beat up a monster, you beat that monster up, and you're fighting him, and you're constantly fighting that lead poison, and you're constantly fighting the effects they have on your life. And you can't stop, because when you stop, you're letting it win. And that's one thing we won't do. We won't stop. So I thank you guys so much for having me. If there's any questions, I'm pretty sure we'll get to them at the end when the moderators open it up for a Q&A. But I really thank you guys so much for having me. I thank you for listening. I thank you for being aware and being in a space where you want to know more, or you want to be involved, or you want to see change. So thank you so much for having me.
Shy, I just want to start by saying you are an amazing mother, and our community and all of the people here are giving you a whole lot of love. And I'm going to read a few comments, but I love your analogy about beating up the monster.
Thank you.
And somebody said, I lost the comments. It said, "This is such a powerful testimony, Shy. Thank you for bringing attention to this through your personal story and educating others in the community." Katie Sparks said, "Thank you for giving back to others, Shy. From you and your son's struggle to build a village in Milwaukee. You are making such a difference in Milwaukee. Thank you for being such a gift. You are an amazing mom and advocate. Continued care to you and your family." My first question, Shy, is that, you stated this, I'm going to bring back Dr. Parady in too. You mentioned that many parents aren't aware of this issue. How do we make parents both aware about the realities and not frighten them so they shut off, right? So how do you gently do that to tell parents about this issue and still keep them engaged?
There's two things that is the easiest way. I can't speak outside of it because I'm actually one of the parents. So the two main things that I would say that helps is, number one, I'm a parent, so I can relate to what you're going through. And we have something called co-parent lead, and that's our parents. And it's a core group of parents who come together, and this is open for anyone, parents. And I say parents a lot, but parents to me consist of uncles, aunties, grandma, grandpa, anyone who is involved in the child's life is considered a parent to me, because we all do teaching. But we're a core group of parents that come together, and we create a space where it's not necessarily talking about lead all the time, but it's a space where I can say, well, hey, my 15-year-old, he is going through X, Y, and Z at school today. And I know it's related to his disability and what he has going on, but how do some of the other parents deal with this? So we create that space where it's safe for parents to come and let off some of that frustration, get some advice, have a relaxed time, a kind of a downtime where you're not dealing with this day to day, because it is a struggle day to day. So that's number one, is relating to parents. Number two is meeting people where they are. Meeting people where they are. That's a big, big issue with getting the community of Milwaukee to participate and to know the information that we want them to receive. We don't meet them where they're at. We have to meet people where they're at. And by that, just a quick example, I actually lived 2 blocks from one of the parents, and she was walking down the street. I saw her with her stroller, and she had a newborn infant. And right away I said, oh my gosh, I got to talk to this lady. She has an infant. I hope she's not drinking the water out the faucet. I need to get her a picture. And I ride around with pictures in my trunk because I do this a lot. I stop people on the street like, hey, how do you drink your water? And so I hopped out of my car and I was like, ma'am, can I talk to you for a second? How do you drink? That's my leading question, opening question. How do you drink your water? And she was like, so we kind of went into this conversation, but she kept highlighting, oh, I'm trying to hurry up and get home. So I parked my car, got out, got my keys out, and I walked with her. And we had the conversation. I walked her home while we had the conversation about where to find lead in her home. By the time we got to her home, I had her phone number, I had her address, I had her name, I had her baby's name, her baby's birthday, her story. I gave her a water pitcher, and I was like, oh, I live right around the corner. So if you need anything, feel free to come by my house, or you want to just talk, just come by my house. She had my information. Until this day, she calls me. So I met her where she was at.
I love that. Dr. Parady, I'm just going to ask you, imagine if we had 5,000 more people like Ms. Shy here, but what's your reaction to her enthusiasm for this topic? And what recommendations would you have for any parents who might be watching around this issue?
Well, I love it, the enthusiasm, as you note, and the word of mouth, the parent to parent, neighbor to neighbor sharing that Shy is engaged with every day. And it's so important and really great to hear as a primary care provider when we bring it up in visits and a parent already has some level of awareness and knowledge of lead, and is oftentimes, especially in our Milwaukee community, expressing a desire for testing and for more information. So it's always great when we start out with an informed parent. Many times, as part of our professional training, particularly the primary care network of providers here in Milwaukee, I know that those conversations are happening and starting early. And we probably have some opportunities to even start them earlier. So, taking it from the pediatric space, even into the prenatal or preconception, before I'm even thinking about having a baby type of a space, to ultimately, again, get from that secondary, tertiary prevention space into the primary prevention, which is what we all want.
Thank you, Dr. Parady. Ms. McElroy, I just want to thank you again, and we just are overjoyed that you are willing to disclose to us some of the personal challenges that you've had and some of the joys that you had. Dr. Parady, thank you for a fantastic presentation. At this time, I'm going to introduce our narrator for the panel, Mr. Langston Verdin. He's currently with the City of Milwaukee Health Department and formerly with Children's Health Alliance. And I presented recently at the American Public Health Association with Langston, and it was a joy to be with him and to hear his passion around lead, children, and the City of Milwaukee. Mr. Verdin, the floor is yours.
Thanks, David. And hello, everyone. I am really excited to facilitate this next section of our presentation today. We've gathered some really fantastic community partners who work directly with the community, who work in public health and other professions, philanthropy, et cetera, who are all passionate about finding a way out of this issue of lead and lead poisoning in our communities. We're going to do a little catch-up time. And so really briefly, I'm going to introduce the presenters. We're going to have a conversation about how we got to this point in the first place. Then we're going to talk about like our current realities, what's happening right now to alleviate this problem, and then have some conversations about the future, the what's next of it all. So with me today, I'm going to just briefly introduce our fantastic list of panelists. We're going to give them 1 minute. I know we said 2, everybody, but we're going to give you 1 minute to talk a little bit about your involvement in this issue of lead. And I promise we will share some, we'll give you lots of time to really dig into the meat of the work that you're doing. So with us today, as you can see on the screen, we have Franklin Cumberbatch with Civic Action Team, Vice President of Engagement at Bader Philanthropies, Richard Diaz, Chair of the Coalition on Lead Emergency, Ofelia Mondragon, the Residential Services Project Manager at Social Development Commission, Brian Weaver, Lead Policy Advisor with the Wisconsin Division of Public Health, and Tyler Weber, the Deputy Commissioner of Environmental Health here at the Milwaukee Health Department. So thank you all for joining me. If you could turn on your cameras, because you'll all be joining the conversation now. I'll start with a couple questions in just a moment, but let's jump right in. Frank, tell us a little bit about yourself and your involvement with this issue of lead in Milwaukee.
Thank you very much, Langston. My involvement with lead goes back to 2004, 2003. In 2003, I ran for mayor of Milwaukee. And in trying to figure out how I can help, I recognize this issue of lead. This is 2003. We've come to the present. I am part of a team called the Civic Action Team, which was formerly called the Civic Response Team, which was put together to respond to COVID-19. We dealt with issues like early childhood education and mental health, physical health, in education and housing. But as we were wrapping up our work around COVID-19, we started to think about what is the next issue we ought to put some attention to. And we concluded that we should pick an issue that cut through all of the ones I mentioned above. And it was a no-brainer. It took less than 30 seconds to decide it had to be lead. And we're really proud as a team. And we are guys from the Zilber Foundation, from Greater Milwaukee Foundation, United Way, your own John Moyer of the college, and Danae Davis. And so we see the Civic Action Team as playing a central role with all of you who are so passionate about this issue that we could bring our resources to assist with once and for all, seeing if we could get rid of this this demon or monster, as Ms. McElroy called it.
Thank you, Franklin. I appreciate that. Richard, let's go to you. What brings you to the table and your involvement with lead and the issues of lead poisoning?
Yeah, thanks for that, Langston. And good afternoon, everybody. My name is Richard Diaz. I'm the chair of the Coalition on Lead Emergency. And that question is something that I often tell myself and ask myself on a daily basis, you know, being from Milwaukee's inner city and growing up in some of the historic disenfranchising situations and systems that create many of the health and environmental issues of our folks. That's something that motivates me, you know, having family members knocking hundreds and thousands of doors over my community organizing career and learning from families the challenges they face. That's what really brings me into this space. And our coalition, the Coalition on Lead Emergency, is a volunteer-based coalition that seeks to educate families, seeks to work with those families and learn those stories so that it can help shape policy and drive some of the solutions for change that we need. But most importantly, not forget the economic opportunity that goes into the big mess that we have with lead poisoning and lead paint abatement, lead lateral replacement. You know, while the federal government is working out different pieces of legislation to help aid cities across the country in this, Cole recognizes this as an opportunity to build wealth and workforce development skills for those that need it most. Thank you.
Thanks, Richard. I appreciate that. Ofelia, we'll move to you.
Hello, everyone. For me, it's both. It's personal. Shy, I was very touched by your story. I had a similar situation where I had to actually formally submit a complaint, get my child tested, and then, you know, learning that my child was exposed to lead poisoning. At that time, I started my career at Social Development Commission in the weatherization program. And that really motivated me and challenged me to learn about lead and the lead issue in Milwaukee. Being in housing for over 10 years, I've seen different challenges, lack of housing resources, to make the best effort to improve quality housing, not only in the city of Milwaukee, but Milwaukee overall. And, you know, the fact that that puts a lot of families, thousands and thousands of families at risk of lead poisoning. And it's not just families with children under the age of 6, pregnant women, but also we see a lot of grandparents taking care of their grandchildren. COVID taught us a big lesson of, you know, we had to stay home for a significant time. So exposed to lead and other environmental hazards truly motivated not just me, but SDC to take a stronger approach to being housing resources. Housing is not cheap, so, you know, doing home improvement is not something that you can just, you know, spend $2,000-$3,000, but it's, you know, a few $1,000s. So that is the reason I am the project manager for SDC and committed to bring housing resources and improving the quality of life of all of our families in Milwaukee.
Thanks, Ofelia. Brian, let's pass the mic to you.
Sure thing. Thanks, Langston. And so I'm Brian Weaver, Lead Policy Advisor for the Wisconsin Department of Health Services, and 25 plus career now in health-oriented areas of work, and all of that pretty much has been focused on advocating for children's health issues. So I find myself in this position, which was created out of a Governor Evers executive order back in July of 2019. So I'm fortunate to be in this position, and it really, the executive orders set charge for my role and the role of the Department of Health Services, which was really kind of twofold: ensure that there was adequate funding and strong policies that could be leveraged through strategic partnerships with other state agencies, as well as local community partners, both in government and non-governmental organizations as well. So I've had the fortunate opportunity to interact with a number of people on this call, kind of working towards that outcome that Governor Evers wanted to see for the state of Wisconsin, which is eliminating childhood lead poisoning. I will say that to kind of keep it concise, that, you know, we've touched on some of the aspects of kind of the outcomes we're looking for at the state level, and I'll just summarize that by saying that our agenda to eliminate childhood lead poisoning really does need to have a strong emphasis on prevention, as Dr. Parady mentioned, that kind of primary prevention before a child is poisoned. So this would include funding to fix lead hazards in housing, in our water systems before children are lead poisoned, policies that ensure lead safe drinking water, housing, and childcare facilities. And lastly, that's been touched on quite a bit already on this panel or on this call, is educating families so they can protect their children from lead. So that's really kind of what I would sum it up in kind of the focus of my work, kind of leading this charge that Governor Evers set forth in his executive order. So thanks.
Great, and we will definitely dig into that more. Tyler, tell us a little bit about what brings you to the issue of lead and lead poisoning.
Yeah, hi everyone, Tyler Weber. Good to be on this panel with so many good people and following Shy. So I've been in my position since May, Deputy Commissioner of Environmental Health for the Health Department here in Milwaukee. I spent 9 years working at Illinois Conservation Corps in Lindsay Heights in the 53205 and 53206 zip codes, and was aware of lead hazards at that time and the massive challenges across the city. And then since jumping in this role since May, developed an even deeper appreciation for really the lack of movement across the city. And on lead, we have tens of thousands of homes that need to be abated, and collectively we're only abating about 200 properties per year. And so really working with the partners on this panel very closely and others to how do we collectively build a system where we are not just scaling abatement to 500 to 800 plus properties per year, but also scaling testing and providing the long-term care that we need for these children and families that have lead poisoning. Just what we heard today, what happens when these kids get to high school and adulthood and are job searching. And so we have a lot of work that we need to do together, and we need to do a better job together. And so it's good to be on this panel and knowing that we're beginning of planting the right seeds and laying the right foundation to, I think, dramatically scale that and the impact that we're making. But overall, I'll pause there, and that's looking forward to learning more and taking questions today.
Fantastic. Thank you, Tyler. So what we're going to do, we're going to jump right into some questions that I have for our panelists today. I invite you as folks in the audience to put your comments in the chat. I will be keeping an eye on that, as well as some of my colleagues are keeping an eye just in case I don't see things, and we'll try to get to as many of those as we possibly can. We likely won't get to all of them. I'll apologize in advance, but we'll do our best. So I want to jump right in. So I, like you, Richard, I grew up in the city of Milwaukee, born and raised. It's a city I'm passionate about. I still live here, own a home here. And I start thinking about kind of what got us here. What were some of the policies and practices that led us to this point? Can you touch on that for me?
Yeah, I can, Langston. And again, thank you for such a great question, because it is a deep one. So, while we know lead contamination is an issue that disproportionately affects the health and well-being of lower income families and communities in color in America, there are studies that show that Black children living in buildings built between 1950 and 1977 are more likely to have elevated levels of lead in their blood than white children living in the same kinds of buildings, much like what Dr. Parady stated earlier. Now, more recently, lead has not been used as widespread as it has been in previous generations to fuel our cars, paint our homes, and carry our water. And there are a number of policies, or lack of, that have heavily contributed to the reasoning why lead poisoning is still a problem in this day and age. We knew of the negative impacts of lead poisoning since about the 2nd century, thousands of years ago, and it wasn't until about 1887 that the first US medical report documented that childhood lead poisoning was linked to lead-based paint. Now, while in the early 1900s, European governments banned lead paint, in America, business giants like the National Lead Company began to market some of the financial and aesthetic benefits of lead, but also promoting some very big misconceptions about positive health benefits. Their lobbying in deep pockets was so much that many cities around the US had lead-based pipes for lead service lines and internal plumbing systems. And even big cities like Chicago mandated their use in building codes. There's also reports of the city of Milwaukee mandated that lead service lines be used as far as back as 1872. So during the early to mid 20th century, we have corporate interests having influence in manufacturing, promotion, distribution of lead-based products, and the government taking some time to build a case for the impacts of lead. But there also was unfair lending practices known as lead redlining that has had a major stake in affecting lead poisoning on present-day communities. So the Homeowners Loan Corporation, also known as HOLC, was a US federal agency created in the 1930s. They developed a neighborhood ranking system that graded the mortgage investment risk of neighborhoods across the US. This ranking system categorized neighborhoods on a scale from A to D. Those rated as A seen as the most favorable for mortgage loan investment, and those rated as D seen as the least favorable. Numerous studies have established that this system led to a discriminatory lending practice that denied mortgages in neighborhoods of color while ensuring mortgages and reinvestment in predominantly white neighborhoods. Hence, in Milwaukee, you see the areas that are predominantly people of color being the areas that have some of the highest rates of lead poisoning in the state. But also these areas have some of the lowest rates of home ownership, highest rates of housing code violations, and some of the oldest housing stock in the country. These neighborhoods also share other demographics like high rates of recidivism, unemployment, labeled as food deserts, and an abundance of blighted homes. So while divestment in housing, health, livable wage jobs, and wealth building opportunities is abundant, the connection between the legislative policy and the private dollars that put us in this situation will be the drivers in how to maintain quality of life neighborhoods from those most affected from lead poisoning.
Fantastic, Richard. Thanks for setting that stage for us so eloquently. And I am seeing the questions in the chat come in. Please keep them coming. Some of them we'll be answering as we go along today. So Tyler, I'm going to jump to you based off of how Richard kind of explained the problem that we're seeing today, or why this problem exists. Can you talk briefly on the city of Milwaukee's lead problem, the scale of the problem that we're facing, really based off of a lot of what Richard talked about? And thank you.
There we go. We have over 200,000, I don't have the data right in front of you, over 200,000 homes built before 1978. A lot of those are rental units. So the scale and the scope of problem is large. It's also an average per unit. Depending who you talk to, is anywhere from $25,000 to $35,000. So, and another way to put it, on average, for lead levels at 5 and elevated lead levels at 5 and above, we have 1,800 children a year that tested that level. And each child then in the city, we think on average resides in 1.9 homes. And so we arrive at that calculation because, one, we're following as a health department with our public health nurses, these children for a year to 2 years, because it takes a long time for the lead levels to drop. And we do need to have 2 safe lead level draws 6 months apart. So again, we're following these families for a long time. And in that time, if they're renters, they're likely going to move, or potentially, every other weekend they're at a relative's house. We have to make sure that's a lead safe environment. If that relative's house is in a different county, we need to coordinate with that health department and make sure that's safe over there. And so that you take those 1,800 children, multiply it by 1.9, and you have thousands of homes that need to be abated on an average basis. Now that $25,000 to $35,000 average cost is really associated with the higher lead levels. So potentially as we get into lower lead levels, the homes are in better shape, but nonetheless, it's a significant cost. And that's just the cost to pay the contractors. That doesn't necessarily the cost of the lead risk assessors, of the organization capacity to do that work. So it's a heavy price tag, and it's a massive scope in Milwaukee. And ideally, we're in a place where we're able to fix the homes before children are lead poisoned, but we have so many that we need to start working our way down the list. And again, scaling not just at 200 properties a year, but we need to get to 500 to 800 plus per year collectively. So I don't know, Langston, if that fully answers your question, but we have a large problem in Milwaukee, and we're a decade or two behind other cities trying to find a solution.
Yeah, and as you're talking, I realize that it's quite likely that we don't know what abatement means in the
All right.
audience. We're not 100% clear. Ophelia, I
Sure.
know SDC does a ton of the abatement work for the city of Milwaukee, as well as in other areas of the state. Can you talk to us really briefly about what that entails when we say a home needs to be abated? What does that mean?
So, we have to kind of take a move from abatement to lead hazard reduction, because these homes, they use lead paint, and painting their walls, painting the air. Sometimes we have outside siding, all the trim around the home. We have doors, porches, windows that have lead-based paint. The basement windows are the areas that usually you see lead paint, especially if you're looking at a built prior to 1978. We do have a significant older housing stock. Most of the homes that we enroll through the Let's Save Homes program improvement are built prior to 1950. So the possibility that this house has in areas around the home is there is a very high possibility. To make a home lead safe, when lead is in good condition, when it's intact. For example, like you can have a wall, and if I'm looking at Richard's wall and it's in good condition, it's not a hazard, right? It's peeling, cracked, or is a friction surface. For example, we have opening and closing the windows is creating rust. So if those windows are original paint, then it's creating that lead hazard, right, in our children. So when we talk about lead abatement is a permanent fix, a 20-year fix or more. Example, when we remove the old windows and we put a new window, is abating the problem. So it's an fix because you're not going to have that exposure. On the other side, there is 4 methods of lead abatement. There is the enclosure. So sometimes when we're aluminum wrapping, when you cover the outside, cover the exposed trim on the outside of the window or the casing around the window on the outside with aluminum, you're covering that lead hazard for at least 20 years. If it stays in good shape. If it gets broken or it gets removed, then you're expecting that lead hazard one more time. There is the encapsulant. Usually that is not likely to be used in Milwaukee because of the weather. And then removal, where you actually move a whole porch and you don't rebuild it. Let's say you don't use it and we eliminate that entrance, you remove the lead hazard. The most practice to keep, the average 23,000. When you talk about lead abatement, and how the Let's Save Homes program approach was, let's do lead abatement. We were running the cost of $50,000 to $70,000 per home. Significant cost, is very expensive, and we're only addressing the in poor condition. So it is the responsibility of the property owner to maintain, to keep up with the properties, because otherwise it's impossible to completely free. So we make the home safe, and we coach the homeowners to learn how to maintain their. Then the lead hazard reduction is a both, like maybe the porch is in pretty, you just have to wet scrape, the lead paint, and we don't have to completely remove it and so it's kind of a mix of both, where you completely eliminate it, and then you also do some interim to bring the area in good condition and be hopefully the family is going to continue to use the paint and or the landlord.
Right. And so you multiply that by the extent of the problem that Tyler was talking about. I think you have a good sense of how big of a challenge we're talking about here. There were two fantastic questions in the chat. One I will assign to Ofelia, and I would say it talks about what resources are available for families who are low income or low income homeowners, renters. I know SDC has a fantastic website. Ofelia, if you could find some of those links and put them in the chat, I'd appreciate it. It'd be a great way to answer that question really quickly. Another question was around the current policies. What policies are existing right now or are being pushed to the surface or advocated for on holding landlords, rental property owners? You know, we have these big companies that are coming in buying up properties in Milwaukee. How are we holding them accountable to fix this problem? Are there shared cost solutions available? Like what type of policies are being floated around in Milwaukee or in Wisconsin? Let's start with Brian, and then maybe Tyler, you can fill in as well.
Sure. Unfortunately, the answer is fairly short, concise when it comes to what's floating around. And I would say not a whole lot when it comes to regulations related to rental property units and the accountability of landlords. Not to say that nothing's happening around that. It is an area that comes up frequently in my conversations with communities and has come up on a regular basis in my conversations with those who are focused on the city of Milwaukee. So definitely kind of on the radar, paying attention to it. I think those who know this work and are particularly interested in looking at you know, what level of accountability we can hold landlords to when it comes to the conditions of their rental property units. There is Act 317 that was back in 2017, essentially preempts a lot of local control over this issue and prevents certain actions that a local municipality like the city of Milwaukee can take to proactively regulate and license and oversee rental properties in their jurisdiction. So that's kind of like, you know, the elephant in the room, kind of like that's out there. It does kind of tie the hands of local government. But putting that aside, there are, you know, I have seen and we have seen creative solutions and innovative approaches to providing that level of accountability. Either it be kind of a kind of enforcement through local ordinance or code violations, or perhaps even incentives to maintain and support the maintenance of properties, like the Lead Safe Homes program. We do target landlords, rental unit owners to fix up their properties, make them lead safe. So there are some incentives out there to focus on this population as well. There are some state policies connected back to this. Wisconsin law, chapter 709, requires most sellers of real estate in Wisconsin to submit a real estate condition report to any potential buyer, which does include identifying any known sources of lead-based paint. However, the law doesn't apply to multi-unit properties over 4 units. So again, a little bit of a restriction around that. There's an admin code, administrative code 134 at the state level that the Division of Agricultural Trade Consumer Protection, DATCAP, oversees. That does require, and is referred to as residential rental practices. That particular code does require a landlord before renting to disclose to a tenant about uncorrected building code violations that they have knowledge of and which present a significant threat to prospective tenants' health and safety. Now, lead paint, lead in water isn't specifically spelled out in that. However, you know, if you have a child or a pregnant woman living there, you could justifiably say that presents a significant health threat to that child or to that pregnant person living in that rental unit. So there are some policies in place to provide some level of regulation, but you know, cities unfortunately do have to get kind of creative in Wisconsin to be able to provide that type of oversight over rental units and landlords.
Right. Tyler, so I'm gonna twist the question a little bit just for you because I think it's partially connected, and maybe you can tell me if I'm missing the mark here. So ARPA, that's something that we all have heard of, the American Rescue Plan Act, and And I think a lot of people are relying on as a, maybe not a complete fix, but to help as it relates to this lead issue moving forward. What's being done with ARPA and how does that fit with your strategy for your team at the department?
Right. So the City of Milwaukee Health Department, as many of you are aware, but if you're not, is getting $26 million, which is a significant adrenaline kick into lead paint abatement. But that money is not exclusively for the health department to implement. Really, the way we're framing is that the health department needs to be a convener in this space and work very closely with SDC, really closely with Cole, local philanthropy, and the universities, as well as other nonprofits that can handle lead paint abatement. So what we want to do is use the funding to jumpstart a citywide lead abatement system where we're supporting the growth of SDC to scale and abate 100, 200 plus properties per year, challenge other organizations and work with them like Revitalize Milwaukee, who do hundreds of abatements a year, and bring them into the lead abatement game so they can abate 100, 200 plus properties per year, where we're working closely together, where we're using the same forms, we have similar workflows, the same vocabulary, the same clearance standards, and there we are really scaling and growing at this together to focus on getting the lead out. And we're going to have to take that perspective to other spaces within lead issues. We have a massive problem with lead testing right now. We need to get more children tested more frequently and potentially even adults. There's more opportunities for education about how pervasive lead paint poisoning is. There's a lot more space to work better collectively. And really the ARPA is an adrenaline kick to get that started and develop funding relationships over time to continue funding this system that we build together, because ARPA does pose a financial cliff, right? What do you do when the $26 million in the next few years does go out? So that is one solution, but at the same time, one of the chat said, is there cost sharing? Is there money that you can put onto the landlords? Like when the lead service lateral replacement, there is a cost sharing with the homeowner. So we're starting to look at that policy. So we are hamstrung a bit by what we can do on this by state law, but I think there's still creative policies that we can look at that we're not fully leveraging. So we are actively looking at that. And there's two approaches to policy that we've already discussed. One is more of the punitive side, orders, citations, which is important. The landlords that have 500 properties should have the capital to fix this, and we can challenge them to do that. But there's also this carrot and stick approach. There are landlords that maybe own 2, 3, 4 properties that can't afford to fix it. They're people of color, low-income neighborhoods, and we want them to be able to keep that wealth for intergenerational wealth building. And we have to be able to support property owners. So one model we're in discussion with Cole is out of Cleveland. They have a lead safe home fund where landowners have access to low-cost loans where $10,000, $20,000, $30,000 to abate the lead, and we can plug them in with the contractors and they get a below market interest rate. And then they pay it off over 5, 10, 20 years. And maybe there's some loan forgiveness in that period as well. So there's unique opportunities and models out there from other cities that we absolutely need to bring to the table here.
Yeah, that's great. And you open the door to my next question, which is going to be to you, Frank. When you envision philanthropy's role in this work, and it sounds, I would love to learn more about the work of the Civic Action Team. How is that team? How do they fit, and how are they dealing with this crisis?
Before I give my answer, I just want to say that we owe Richard Diaz a huge amount of credit for where we are today, because this young man has led an organization on fumes, Langston, on pennies, okay? And the role philanthropy ought to play is, now that we know who he is, now that we know what Cole is, we got to give them the capacity now to do their work and to do it well. There's a lot of knowledge he still has to have, We have to give them the power now to fight, not just in Milwaukee, not just in Madison, but Richard Diaz has the sort of the personality and the drive to be fighting in Washington, because I must tell you, 200 homes a year is an embarrassment. Okay, our children are dying, and philanthropy, which is what we're doing in the Civic Action Team, is coming together as one to say, how do we empower these organizations to now have what they need to do their work? At 200 per year with 70,000 laterals to replace, we'll all be dead, and our children's children will be dead. And it is not acceptable, right? And so we want to be able to say, how do we utilize our resources to send that message that Miss McElroy needs to be just cloned like 20,000 times, right? And Richard and others to do their work. I am so proud of them, but I see blue skies ahead, because this conversation, guys, a decade ago was not happening, right? And so what we need to do is to coalesce as one. Philanthropy is one slice. The health department, the rest of government is another slice, the nonprofit community. But where is the role of the corporate community? We do not have one for-profit guy in this conversation. And none of them will make money without our children growing up, getting educated, and sitting in that office and making money for them. So they have a responsibility to see that our children are raised with all the tools to succeed. And I am calling for this to stay together, for us to fight this fight as one. Not that the health department go off and fight one fight, and Richard fights another fight, and Brian is fighting a fight, and philanthropy is trying to see what they can do. We need to do this as a unit, and that is what I think philanthropy is really good at, convening all of us together with under one plan, and stop being so nice and show up in Washington and say, we want our money because we want our children to grow well. That is what I think. But that's a big chunk of that is me, but a major part of that, in all seriousness, is philanthropy is positioned very nicely to bring capacity to those who show so much passion for their work, including Tyler. When he was out here in the nonprofit, he showed that passion. So this is good change that's happening in the right direction. And I think that's where we fit into this entire war we're fighting against this this monster that Miss McElroy has deemed it to be.
Absolutely, and you know, I get that same sense as you, is that that the blue skies are coming. As I've gotten a chance to get to know all of the folks on this panel, but even as I look through, you know, who are our audience members, the folks who are on this call as well, a lot of folks who are committed to this work, and you know, seeing this work through. This isn't a one and done type of situation, right? Richard, when you think about the work that's going on right now, the folks that we have in this room with us today, what are some of the, you know, we got to have those opportunities to celebrate our successes, right? We've done a lot of work. As Frank mentioned, it's been many, many years. What are some of the wins that have been going on at the city, state level, federal level, even if you can think of them, that are worth celebrating, or kind of those upcoming things that Cole is working on that you want to highlight as well?
Yeah, no, I must just thank Mr. Cumberpatch for his acknowledgement of myself and my coalition's work. You know, I must give a shout out to our coalition members who are unpaid, working tirelessly to protect children. Special shout out to Miss Ann Batiza with the League of Women Voters, Pastor Dennis Jacobson with Micah, Diane Daglin with Sierra Club, Terry Wiggins with Interfaith Earth Network, and many others are part of the coalition. Of course, Ofelia, who's been there with us every step of the way and helped shape everything we do. So, kudos to those folks, and much praise and love from my heart. So some of the recent wins, Tyler touched a little bit on the most recent city wins with ARPA, the $26 million going to lowering the actionable level from 15 down to 10, and then also servicing families who touch lower than 10 with public health nurse and case management support. It's a great start. And I think the collaborative approach that we're beginning to take to engage more nonprofits, build the capacity of contractors, it all needs to be celebrated, because we weren't in this position when Cole started 3 years ago. Now we have folks very knowledgeable and aware of what's going on. And I think ARPA really reflects that. There's two more key significant victories within ARPA are, $3 million that we worked with Employment Milwaukee to secure, so that we can train 250 lead abatement workers and supervisors over the course of 2 years. There's a workforce shortage all across the board within many different sectors. And we want to go after this head on before infrastructure dollars are available, because we know that once those federal dollars become available, that'll feed us more fuel to our fire and our initiative. So taking those 250 folks from the most lead poison zip codes, 53206, 53208, 53210, 53212, is really what equity looks like in real time. So that economic opportunity and building those folks' capacities to be able to, have good paying, livable wage jobs. And then the last piece with ARPA is $2 million going to the ECO office. So we are so grateful to have many partners around our coalition table. And most recently, Cole acquired Green Homes and Healthy Initiatives as a coalition member, who specializes in braiding philanthropic dollars, public sector dollars, and then also, being able to engage other partners and healthcare systems in that work to keep the funding going. As Tyler mentioned, ARPA is going to be short-lived. So what's going to be our game plan afterwards? How can we plan comprehensively over the next 10 years to ensure that this work is funded through public-private support? At the state level, Cole advocated for the state of Wisconsin biennial budget. We had some very big, robust asks around funding health departments across the state, because we know, just like our health department, many rural and suburban communities don't have the resources needed to protect children from childhood lead poisoning. So, we did see an expansion of the Lead Safe Homes program, a program that SDC is very well at officiating and being able to abate homes each year. We got about $4 million to go into that pot of money so that we can abate more homes. On the federal level, we have, the Infrastructure Investment and Jobs Act that just recently passed, which contains $15 billion for the replacement of lead service lines and funding for weatherization assistance programs, which include funding for healthy housing and safety, which lead can be a part of that, but there was not significant funding in the infrastructure bill for lead alone. So the bill that's being worked out through the Senate currently, the Build Back Better Act, contains $5 billion specifically for lead-based paint and healthy housing interventions. So lots of great stuff to celebrate. Even more hard work for us to get this across the finish line so that we can have that initial investment to begin this work.
Thank you, Richard. That was a fantastic recap and a lot of work to be done. But frankly, I don't think, the reality that it is, we can't have this conversation without talking at least really briefly about how COVID has impacted this work. Like all of you, I'm sure folks are dealing with vacancies and contractor issues, and just finding the right people these days is really difficult. We've talked about workforce development and how hard it is sometimes to find contractors. Ofelia, how is SDC navigating that, and what are some opportunities that you see as, fingers crossed, the pandemic slowly starts to wind down and more people get their shots and stay masked up? What do you see as some of those opportunities? I'm sorry, it's a two-parter. How has COVID impacted the work? And then what are some future opportunities?
Sure, I'm gonna turn off my camera. Hope you guys can hear me clearly. You
Yeah.
guys can give me a thumbs if you can. So pretty much COVID, I think it brought a lot of challenge and also opportunities, and it challenged us to think out the box. You know, we also create a sense of urgency because, you know, it's one family at a time, one home at a time, but whole team, including contractors, vendors, vendors, we came together and it gave us the opportunity to create a strong partnerships, like working closely with the health departments in communicating back and forth, contractors, and being able to adapt to a very work as the families, right? Instead of doing one-on-one conversations, we were doing virtual conversations. And no material delay was a significant challenge for SC. However, it really pushed us to think outside the box, and I cannot take the credit. I have to give the credit to my Joel Kearney, who was able to bring local vendors, window distributors, and set up contracts with them so we can order materials and we can prioritize those orders and be able to continue with the production. A huge relief for the contractors and strengthen the partnership and relationship with local contractors. SDC is committed to, just like Shai mentioned, you need to meet the customer where they, we also have to challenge ourselves and meet our contractors and vendors where they are and work with for them to learn how to navigate the system. COVID really motivated us because we wanted to get to those homes, make them safe, and, you know, take a different approach. It also highlighted the importance of empowering the families, educating them to reduce of lead poisoning, you know, empowering them, saying, you know, this is how you can vacuum your windows. This is how you can vacuum your floors, cleaning practices, and working with them in the meantime. It really gave us the opportunity, probably, you know, a project that would probably take months. It was taking 6 to 8 months by the time the contractor got to the home. So it was a, you know, not a challenge, but, you know, for us is we have to see those as opportunities for improvement.
Absolutely. So thanks for that, Ofelia. And I want to thank everyone for joining us today. This is a conversation that has to continue to happen. And the thing I love about this conversation and having it with this fantastic group of panelists is I know it's not just going to be a conversation and the work stops when we get off this call. These are folks who are serious, who are passionate, who are going to make sure to hold each other accountable, because we all love this city. We all want to see the city thrive. We are raising families here, raising communities here. And it's important to everyone. So thank you to our panelists for joining us today. Thank you for everyone who is in the audience. Really quickly, please make sure you register if you haven't already for our second session, which is on the screen here, clinical responses and solutions to lead as well. So grateful to have you all with us today. Thank you so much for coming.